Hi everybody, my name is Anish, and today we're going to talk about cervical spine strain. And so let's break that up really quickly. Cervical spine refers to the 7 vertebrae that help support the neck, and strain refers to any kind of muscle injury. So what's happening is that there's a lot of different muscles in this area, and from a number of different mechanisms, there's these little micro tears in the muscle, and that's what's usually causing the pain in the patient. So we'll quickly talk about the different causes of cervical spine strain, how the patient will often present, how we could diagnose it on physical exam or even some imaging, and some treatment options. So let's go ahead and get started. So some different causes of cervical spine strain, the most obvious would be trauma. Now this is important to ask the patient to see if they've been involved in any kind of sports injuries recently, if they've fallen, any kind of car crashes with whiplash. All of these things can cause cervical spine strain. Some other things that could cause it, and quite commonly, is poor posture. A lot of us sit on desks and have this forward head carriage that kind of causes misalignment of the natural curvature of the spine, which is kind of seen over here. You know, this is good posture and good curvature. The other thing that can cause it is a herniated disc. There are these little padded areas between each vertebrae, and sometimes that can push out and compress a nerve, and that can cause pain and some nerve symptoms, as we'll mention in a little bit. Illness is also a cause of cervical spine strain, and sometimes we just don't know what it is. So now let's talk about the symptoms of cervical spine strain. Usually you'll see pain just right in the neck area and posteriorly usually in the backside. The pain will often occur when the patient moves the neck or their head. They have difficulty sleeping because it hurts so bad, and sometimes it hurts so bad that it can cause headaches, and that might be something that's a little bit more serious or alarming to you. And sometimes it can cause nerve injury, and that would result in numbness or weakness in the cervical spine area. That usually presents with numbness and weakness in the shoulder or the arms, or numbness or weakness in the hands and fingers. So how would we diagnose cervical spine strain? Well, on physical exam, you could do a couple of things. You can look for neck tenderness when you press on the neck, some weakness for the patient. Um, because they're so stiff, they might have some limited range of motion. And sometimes the physician will do a maneuver where they'll compress the patient's head while it's turned, and that'll elicit neck tenderness, and that might be a sign of cervical spine strain as well. And if it's more severe and involves a nerve, then sometimes you'll get loss of reflexes. Now, sometimes we like to confirm this with imaging or help kind of guide us in our diagnosis, and so we can get x-rays or MRIs as seen in our left pictures. Now, the treatment of cervical spine strain can vary. So we like to go start with conservative treatment. So avoiding aggravating activities is extremely important. So no roller coasters, no heavy lifting. Some patients find relief by icing their neck 15 minutes 3 times a day. Some medications can be used, so some over-the-counter creams or some creams that we can provide can help decrease the localized pain. We can give some anti-muscle spasm drugs like Flexeril, some anti-inflammatories like Aleve and naproxen. Some pain medications have also been found to be helpful, like tramadol and Norco, but those are usually just in very severe cases when the patient's really not getting better. Some neck braces can also be helpful, so you don't want to put them in it for a long time, but some short-term neck braces are helpful. Home exercises, as seen as like rows, are really good for reinforcing good posture, or formal physical therapy, as seen in this picture. We can also even give injections to help reduce the inflammation in that area with steroids. Some surgery would be helpful only in severe refractory cases when it's really not getting better, and usually seen in herniated discs. So that's pretty much all we have for cervical spine strain. I hope that was helpful, and we'll see you guys at the next video.